Well, it's our pleasure to have the Principal Chief of the Cherokee Nation, Chief Chuck Hoskin Jr., joining us today here on our Newsmaker interview. Chief, thanks for joining us.
Well, it's a pleasure to be with you. Thank you so much.
Well, I know that it's been a busy week for you. I know it's been a busy time for you. If anybody had ever told you in your first few months as the chief of the Cherokee Nation that you would have this COVID-19, that your casinos would be shut down, revenue streams halted, I'm sure that was something that you were totally not expecting.
You know, I thought the gaming compact dispute was going to be a big deal, and this comes along, and it's something that no one could ever imagine. So, the good thing for Cherokee Nation, though, is in terms of a government, and this isn't a reflection on me; it's a reflection on what we've built up over decades. We've been very prepared for crisis situations. I don't think any government in the world is prepared for COVID-19, but I do feel like we've had a team in place that could respond to something of this magnitude, because I've just been impressed by how they perform. So I'm very grateful, though, as surprised as I am grateful that we had the team that we had.
What are some of the biggest challenges and maybe surprises that you've had to deal with in your office so far? And what would you say the biggest challenge for the Cherokee Nation is getting through this?
Well, our challenge is something that's familiar to Americans across the country, which is learning to operate in a situation in which we have to social distance, in which we have to close down operations. So as a general proposition, when we say we're all in together, we all are all in together, and we're dealing with very similar things. I think with respect to Cherokee Nation, we have to remember we're a government, so there's certain functions we have to continue to carry out. The biggest part of our operations happens to be healthcare. And of course, healthcare is on the front lines of a COVID-19 response. And so we have the largest tribal healthcare system in the country, about 1.3 million patient visits a year and growing, which makes us not only the largest tribal healthcare system in the world, but if you look at the state of Oklahoma, we're one of the major players in healthcare, given the amount of patients that we take care of, the programs that we have, including public health, which, as everybody's learning, turns out to be very important when you're talking about dealing with a global pandemic. So one of the challenges is to keep that operating, and you want to do so as safely as possible. And so health systems are all challenged with doing that. And the primary way you do that is to keep the staff safe, because those folks are putting themselves in harm's way, of course, every day. So getting those PPEs, we're all learning that three-letter word, PPEs, and we're knowing what it means, which it means the mask and the gloves and the other types of things to keep people safe. And so one of the challenges was early on was to get as many of those available as possible. So one challenge has been healthcare, testing, another aspect of healthcare that we, like every health system in the country, I think struggled with early on, but we gained our footing, and I feel like we're in a very strong position on PPE, strong position on testing. Ventilators, right now we're doing good. We have more on the way. We've done some innovative things, which I could talk about on helping people with respiratory problems using 3D printers and some ideas from around the globe. So on healthcare, that's been a big challenge. The other challenge is dealing with every bit of our revenue outside of those federal streams of funding, which are important, but every bit of our revenue just going away, really at the stroke of a pen on March the 16th, when I said shut down all of the casinos and hotels, shut down our businesses. We started with the casinos, which is where, of course, you have big crowds. We did it because it was the right thing to do. It was a responsible thing to do. And we also started to reduce headcount in our government operations and really whittled it down to just those that are mission critical. That, is something that's difficult to do, because getting people out the door that really in their hearts want to be there and serve, or really are anxious about their jobs and wonder what's going to happen next, that's difficult. I think we've been in a strong financial position so we could make sure to pay everybody. So nobody's missed a paycheck as a result of this, which is good. But that's another challenge, is how do you really wind down your businesses so quickly, understanding the impact that's going to have. And then how do you reduce your government operations so you're operating in just the critical functions you need to do. Those are just a couple of challenges. It seems like new challenges come up every day, but that's what we're dealing with on the large scale.
In your planning, has there been any guidance whatsoever from the CDC or the powers that be on when you could start implementing plans to open back up?
Well, I wouldn't say the CDC necessarily has told us when we open back up. part of the problem through this whole thing is I think we all in the country want to hear a really consistent message out of the government of the United States, the federal government, whether you're a tribe, whether you're an individual. And I think through this, to me personally, there's been a little bit of muddying of the waters about when we reopen. The very best guidance that I've heard has been from Dr. Fauci, that works with the President of the United States. He said something important that has stuck with me, and I hope it sticks with everybody. He says, the virus doesn't care what day it is. And to expand that further, the virus doesn't care who you are. It doesn't care if you're a tribe. It doesn't care if you're a state. It doesn't care where you live. It doesn't care who you are, how much money you have. The virus doesn't care about any of those things. So we're somewhat at the mercy of the virus in terms of when we reopen. We're taking it, though, in chunks. And that we've tried to be a bit consistent with some of the guidance we get out of Washington, D.C. in terms of what the outlook is. So initially we said, okay, March 16th, we'll take it to the end of March, see how things were. Well, as we know, at the end of March, things were actually much worse. We continued it on to April the 17th was our next target, which hasn't come yet. But last week we said, look, we've got to keep it closed through the end of April. So right now, May 1st is our next target, but it's not a hard target. I mean, what I've said all along is here's how we're going to make decisions at the Cherokee Nation in the COVID-19 pandemic. We're going to be driven by medical science, facts, and then compassion for our fellow citizens and our friends and neighbors. And if you use that as your guide, decisions are going to be difficult to make still, but at least you have sort of a guidepost to go by. And so if my experts at Cherokee Nation, and they'll probably be echoing what the experts at the CDC say, if they say, look, social distancing still has to be the order of the day, and we can't have large crowds getting back together just because it's May 1st, we're going to have to keep those things shut down. The difficulty will be keeping us on a firm financial footing operating this way, because I say nobody's missed a paycheck, and I want to do that as long as we reasonably can. But the key word is reasonable. We can't completely lose all of the resources that the Cherokee Nation needs to continue on by doing this. So it's a balance, but health and safety is the very most important factor.
I know that the Cherokee Nation is stepping up in a lot of ways to help citizens in need. I know, for example, in Owasso tomorrow, Councilor Joe Deere is doing a grocery giveaway that's going to be happening. And that's just one of many things that your individual councilmen and some of the other Cherokee officials have been heading up. And I know that's got to be a relief to you to have people who are willing to do that.
Absolutely. One of the things that this crisis has done is it's been very unifying for a lot of Cherokee citizens and officials. And so when we were closing down the casinos, I was sitting with Brian Warner, our deputy chief. And the very first thing he said after we made that decision, he said, you know what, there's perishable food in those casinos. We got to get it out the door. I said, you're right. We got to get it out the door. So we got it out the door to as many elders as we could, as quickly as we could. We really have created the largest emergency food initiative in the history of the Cherokee Nation. One way we've been successful is it hasn't been a completely top-down operation. I mean, look, I'm chief of the Cherokee Nation. I believe that government can do good things in communities, but I also think that sometimes we can gum up the works if we get too much government involved. So what we did was we said, let's let the grassroots community organizations, council members sort of drive how we do it at the local level. So we obtained more food, perishable food. We had some emergency funds to do that with, and we deployed it out to community organizations. And then they got it out to where there was need. Now we tracked it to make sure we were getting the elders taken care of. And then up in the Owasso area, it's a different area. It's sort of a suburban area, but there's still a need there. The need is for food for those who have food insecurity, and there's a need to keep people in their homes. And if you can keep them from having to go to the store, particularly elders, well, you've done a great thing, not just for them, but for their whole community. And so in that area, and I credit Councilman Joe Deere with that, is a little different because there's already some organizations up there that were already doing some food security work. So he joined with them. We sent some resources, and I think it's been very effective there. Other parts of the Cherokee Nation, there's been maybe one rural community organization that's taken it on, but they've done amazing work too. And so I feel good about that. So there's two things we've been doing. We've been taking care of healthcare. We've been taking care of food. There's other things that go on, but if you can take care of those two things in a crisis like this, I think you're doing good. And I think we've been very effective on both fronts.
Just a couple more things. I know that right now the order of the day has kind of been the stimulus of different things by the federal government of the United States. And one of those things that has been part of the CARES Act is tribal funding. And I know that it's important to you to get what you can, kind of some, I guess, logistics being worked out. And I know that there's some conflicts that have been brought up in the news, a few reports on what's going on between the tribes here and maybe some of the natives in Alaska who may also think they qualify for some of this funding. Kind of break that down and tell us where that stands.
Yeah, and another thing none of us thought we'd see is we'd get to this point and then suddenly there'd be some issue between Alaska and Oklahoma. It doesn't make a lot of sense at first glance. I will try to break it down as best I can. So, the CARES Act, which passed Congress, over $2 trillion, a lifeline to the country to get us moving again as a country. We have to do that. This isn't just a bailout for one industry or another. We're all shut down, so we're going to have some kind of federal response. I agree with that, and we should do that. I was very pleased to see that of that $2 trillion, I think it was actually $2.6 trillion, $8 billion was set aside for Indian country. That's significant. I think that's a reflection of the strength that we have, that we've raised our voices, that we've shown what we do in the economy. I mean, Cherokee Nation is a big driver of the economy in Northeast Oklahoma, 12,000 jobs. Actually, it's closer to 12,000 jobs. We support another 19,000 jobs, multi-billion-dollar impact on the region every year. So whether we succeed or fail will drive whether the economy around here succeeds or fails. So that's sort of the context within which tribes need these dollars. We're governments, and so what we've had to do is we've had to do the same with less. We've had to draw down reserves. We've missed opportunity for our only revenue sources, which is gaming and other businesses, to operate and have money coming in the door. So we've taken a big hit. How do we fix that? Congress is appropriating dollars. So just to sort of get a little bit into the weeds, every federally recognized tribe in the country was to get some portion of this based on some factors. And the factors could include population, it could include land base, it could include employment numbers. A variety of things could be some of the factors that drive sort of how much tribes get as a proportional basis. So Alaska Native villages are among those federally recognized tribes. There's 574 federally recognized tribes. And so we know what group that is, and it includes Alaska Native villages. And so all of those members up there should get a share through their governments. Here's where the rub is. There are entities that were created under something called the Alaska Claims Settlement Act. Essentially, it created state chartered corporations dealing with a lot of oil revenue, okay, up in Alaska. It is connected to Native peoples in Alaska, but these are not tribes. These are not tribal governments. These are businesses. In fact, some of them are real big businesses, and they do a lot of work and a lot of revenue. And so Congress didn't say that the Alaska Corporation should get this money. They said tribes should get this money. That means tribes in all the states where there's tribes, okay, all 574, including Alaska. What's happened is sort of at the 11th hour, and this, unfortunately, I try not to be a cynic, but this is how DC seems to work sometimes. Corporate interests sort of came in. And even though this is Alaska Native and natives in the name, these are still corporate interests. They came in and they wanted a piece of this relatively small compared to the whole 2.6 trillion, relatively small amount, 8 billion for all of these tribes. It's patently wrong in my view, but it's not just my opinion. There's a growing number of voices across the country of tribal leaders that said, look, Congress was sending a lifeline to tribes specifically. We can't have these things that are corporate creatures of the state of Alaska come in and pose as tribes and get this money. It's a big deal because as a principled matter, again, this money is for tribes. But here's the other thing. If you look at the land holdings of these tribal corporations, these Alaska Native corporations, I should say, if you look at the total, it's bigger than any single tribe in the United States except the Navajo Nation, which is very big. It dwarfs all the rest of the tribes. And so if land holdings is a big factor in how much of this 8 billion comes to Oklahoma, where there's a lot of tribes, that means we're going to get a whole lot less. Why does that matter? It's going to be harder for the Cherokee Nation to get back on our feet. Why should the rest of Oklahoma care about that? get back to what we talk about a lot at Cherokee Nation, which is we drive the economy in many ways in Northeast Oklahoma, and other tribes do as well. And so if we have a harder time getting back on our feet because Alaska corporate interests have come in and sort of did a cash grab at the 11th hour, doesn't just hurt the Cherokee Nation, it hurts Oklahoma. And so this is really an issue that we all need to know about, even though it gets a little bit in the weeds. Getting to what we're doing about it, we're reaching out to the agencies that are in charge of dispensing this money, working with our congressional delegation. I do want to say our congressional delegation is wonderful on tribal issues, particularly working with Congressman Mullen, Senator Langford, and Congressman Cole, certainly. We've talked to them. They seem very supportive, but things are moving very quickly. It moves very quickly in terms of the federal stimulus response. So I don't know what the outcome will be, but if folks, and I appreciate you paying attention to this, but if folks hear about this sort of dispute with Alaska, that's what it's about. Other people might have a different viewpoint. I think if you had the corporate exec from one of those big corporations on here, he might tell a different story. She might tell a different story, but just about every tribal chief that you talk to will say, now, this is not right, and there's a whole bunch of legal reasons why it's not right.
Well, Chief, thank you for your time today and the overall scope of things regarding COVID-19 and all we're going through right now. If there's anything you could tell the tribal citizens of the Cherokee Nation and just Oklahomans in general as far as hope for the future, what would it be?
Well, the future is going to be bright. When we can get back on our feet depends on something important. And this is where it comes down to what we as individuals can do. We look to government for a lot, we should. But the more that we hunker down when we can, the more that we keep socially distant, the better off we'll be. Why? Because it'll slow the spread. If it spikes too high, it's going to overwhelm our healthcare systems, and we're going to see things like we've seen in other parts of the country. That'll be bad for Oklahoma. So we all sort of have this responsibility to do the right thing. We do look for government to do the right thing, and that's important. There's a strong role for that. But at the end of the day, it comes down to what we do in our individual lives. And if you can stay home, and some people can't, and some people are on the front lines in healthcare. If you can stay home, my message is please do stay home. The more you stay home, the quicker we'll get through it, the quicker we're back on our feet, but the future will be bright. We'll get through this. I want to say one thing. Cherokee people have been through even worse than COVID-19. We got through that. We'll get through this.
Okay.